Friends, I am so excited because today's guest is someone who has been on the front lines of science, truth, and keeping us all informed in moments when the world felt upside down. Jessica Malaty Rivera is an infectious disease epidemiologist and one of the clearest science communicators of our time. We are so lucky, y'all. You probably first came across her work because I know you're following her on Instagram during the height of the COVID-19 pandemic, when she helped lead the COVID tracking project at The Atlantic. Now, she took complicated, often overwhelming data and then translated it in a way that was accessible, human, and deeply grounding. It's like real people speak for us. And this work landed her on Fortune's list of the world's 50 greatest leaders. But her impact goes far beyond COVID. Today, Jessica serves as Senior Science Communication Advisor at the de Beaumont Foundation, and she continues to champion health equity, vaccine education, and truth-telling in a world crowded with misinformation. She's also an incredible mom, a leader, and a fierce advocate for diversity in science. I am so honored and super excited to welcome her here today. Jessica, thank you for being here with us.
Thank you, Nicole, for having me. That was so sweet.
Oh my gosh, I can't even tell you. So I'm a science nerd. Okay, everybody already knows this, but I have to ask you, if with everything that's happening in this world right now, post-COVID, if that's even such a thing, are we ever post-COVID, right? But with everything happening in this world right now, if there was one truth, right? One thing that you wish you could zap into everyone's mind about science, about bugs, germs, right? Because that's your specialty. From your professional experience, what would it be?
There's like 100 things I would say, honestly, but I feel like because public health as a space is so misunderstood right now, I feel like I just want to reinfuse into the public that public health at its core is about community. It is really about the relationships that we all have together in small and large communities on the national and global level to keep each other healthy, to keep each other safe, to reduce harm, and for our collective thriving. And I think it's been turned into this idea of control and mandates and authority when really it's very altruistic at its core.
Oh, wow. So tell me more about that, because hearing that science is not just about my personal values, but our values as a collective, and that my health decisions are interwoven with your health outcomes is something that you don't really hear a lot of anymore. But it sounds like this is kind of the core of, is this just your value system, or is this like the core of public health?
Yeah, I mean, I think it's in many ways a common denominator of a lot of things. And so it's not necessarily a new concept. Now, some people have a reaction to it because of this hyper individualism that we've seen, especially heightened during the COVID-19 pandemic. But at the core of it is just saying that the decisions I make don't only affect me. And I think that's part of just being a human on this planet, right? Like, we don't exist in very isolated bubbles. Everything we do has some sort of impact on either a smaller or larger radius. I think about that in my immediate family, the decisions we make as a family, and I think about that in the communities that I exist in. And so vaccines, as one example, is, I don't do it just to protect me. I do it to protect people around me, to reduce the harm of people who are at greater risk than I am. And I think that so many things in public health are that too. It's why we have food grading systems. It's why we wear seatbelts. It's why we don't drink and drive. These are decisions that we've all agreed to as part of what some folks call a social contract,
right,
to keep our society thriving and safer.
Yeah, and growing.
And
right?
growing. Yeah.
So I think that there are a couple different things that you broke down there, and you're so good at this. So I'm going to selfishly kind of grab as much knowledge as I can out of you. First, what is an epidemiologist, right? Because I know that a lot of us have become familiar with that word or glossed over it when we heard it because it had just too many letters, right?
Yeah.
What is your role then? Because you've been doing this for over 2 decades now professionally. Can you tell me a little bit about what your role is in the study of this, and how you kind of fit in with decision making in the government, with us, where would an epidemiologist, because I wouldn't just visit one, right? If I have a cough, I don't go see an epidemiologist.
Right. So an epidemiologist is not somebody who talks about skin. I think some people are like,
really? People think it's like a
like a dermatologist.
Wow.
Not
I
not
get
even
that
close.
though, but that's actually pretty smart. That means you know your Latin roots, y'all.
Yeah.
If that's what you're going. Good job. Good
Not
job.
a skin doctor.
Yes.
No, we're in the most like simple, silly term, we're like disease detectives. So we're trying to understand kind of the origin, the who, what, when, where, and why of a disease or an outbreak or an epidemic. We're asking all those questions to understand how it's happened, why it's happening, to whom it's happening, what the future of that happening is, and then coming up with solutions after the fact. So it's very data focused. My specialty is in infectious diseases because that's what I studied in undergrad and in graduate school, specifically emerging infectious diseases. So that's like new viruses, new pathogens that kind of either spill over from other species or just emerge.
It's like more COVID and less malaria is kind of.
But
your
that's a
specialty.
great distinction. Okay. So COVID is a infectious disease that is respiratory. Malaria is a vector-borne disease.
Okay.
They are both in the realm of disease that can spread and are very impacted by varying factors like climate and populations. And climate change, which affects both of those things. But I'm much more into the human-to-human transmission kind of vibe than the vector-borne.
Got it. So I'm going to ask this question too, because I think a lot of people may not understand where, and even me, to know more, where would an epidemiologist work? Like, do you work for big pharma? Do you work for corporations? Do you work for the government? Do you just work in a little lab in your house? Like, how are they paid? And does that affect sort of the data that you get to see, analyze, and the results you make?
Yeah. The simple answer is yes. Like, they could work in all of those settings. They can work in local public health departments. They could work for the CDC. They could work for HHS. They could work in pharmaceutical companies. They could work for nonprofit organizations. They could work at home, like myself. So
it's not always lab work.
No.
Sometimes
In fact,
it's a lot of reading.
It's not really lab work. Some folks who are lab-based can certainly do that. I definitely did my time in the lab and realized I was way too extroverted.
Did my time.
Oh, yes. With the micropipettes and the whole thing. Ooh. And I realized I am way too extroverted to be in the lab. But a lot of epidemiologists are data scientists and work a lot in spreadsheets and work a lot in sometimes doing like field work and population surveys. But it really depends. And I think it's kind of cool because it's not a single type of job. It's not a single type of skill. People can be really, really focused on, outcomes. They could be focused on prevention. They could be focused on things that are not even diseases. They could be focused on gun violence. They could be focused on social determinants of health and the things around our populations that affect our outcomes. And so I just happen to be the infectious disease kind. Because
that makes a lot of sense. Yeah. Okay. And so that's really helpful, I think, for all of us who are trying to figure out, when something goes wrong, we're always kind of like, where do we look for the info? Yeah. And because of the internet, oftentimes the internet gives us the answer we're looking for, but we don't necessarily think to ask, okay, are you qualified? And who is the person with that qualification? So one of the things that I recall big time during COVID was everyone kind of had a take. Everyone had a perspective, or, people would say, well, I'm a doctor. And, I always try to remind myself, you can be a doctor of philosophy. You can be a doctor of art history. So when I hear I'm a doctor, you may be making me assume that you're a doctor that has familiarity, but even a doctor who's a family medicine doctor might not have been the best person to ask about disease, which is where you kind of came in, because you could break down the science, the data, and you may not have had a prescription for my cough because that's not your job, right?
That's not.
But you could tell me, hey, this is probably how this happened.
Yes. And there was a lot of that. There continues to be a lot of that. And even just kind of like the credential checking of each other can be pretty toxic. But yeah, there were many, economists opining about the epidemiology of COVID-19, which was very frustrating. Yeah. There were many people who had, who were chiropractors talking about naturopathic and infectious disease remedies. And so experts is a very broad term. And I do think one of the fallout of what's happened right now, especially with social media and popularity of certain creators, is that there's almost like a death of expertise happening where popularity is now the same as expertise to some, visibility, clout, influence,
money. Yeah. If you just have money or something to sell that seems to lend itself to well, if you got the money, you must know a lot of things,
Yep.
but that tends not
Yep.
to be the case. Can you tell me a little bit about what you personally have done to become an epidemiologist? Like what, just high level? I don't know. I mean, is that a certificate? Is
Yeah,
that
yeah.
what is required to know something about infection?
Yeah.
And y'all, I just hope you're hearing this because I just want you to know I always try to bring you people who are qualified, credentialed, capable, and I just want you to be able to use this as a baseline and just kind of put it up against what you see as you're deciding. You can always choose to believe and listen to whomever you want because we're all our own people, but at least let's make sure we have some options,
Yeah.
before we do that. So, is epidemiology a certificate? Is it
Yeah.
a online course? Like, can you walk me through?
It's a lot of years of school. So I had the great fortune of actually being exposed to public health education as an undergraduate in college. I got my undergraduate degree in health promotion and disease prevention studies. And that's where I got, my first trainings in biostatistics and
That's 4
epidemiology.
years.
That's 4 years.
Okay.
Then I went to graduate school, and that was in a school of medicine, and studied emerging infectious diseases and biohazardous threats.
And that was
so
another
2
2
years.
years. Okay. So that's
and
6.
That's 6. And then I am actually getting my doctorate now at Johns Hopkins and studying again.
Johns Hopkins School of Public Health?
School of Public Health.
Isn't that the number one, or it's up there?
It is the number one, yeah.
school of public
Yeah.
health in the world.
Yeah.
Wow, congratulations. It's
Thank
very
you.
good. It's
Yeah, I'm
very
getting
good
my
school.
doctorate in public health, so a DRPH program. And it's, again, more training in all of the things that I've been training in
And that's
for a
another
while.
2 years, I think, right?
Oh, no, like 4 to 6.
Oh, that's 4 to 6.
Yeah,
Okay,
because
got
that's a
it.
doctorate.
So cumulatively 12 years.
Yeah. It's not the same for everybody. It could
Sure.
just be like you can be an epidemiologist with an MPH if you focus on epidemiology, right? Like an MPH doesn't necessarily mean you're an epidemiologist,
Right.
nor does even taking classes in epidemiology make you an
Sure.
epidemiologist. I happen to work in that space and worked a lot on data.
Got it.
So I did a lot of work in biostatistics. I did a lot of work in understanding the kind of patterns of emerging infectious disease outbreaks and what that meant in like the surveillance space. So I leaned into that route of public health, and that was why I specialized in epidemiology.
That's really helpful, I think, for all of us and for me to hear, because it also lets me know, aside from your actual practice and expertise working and writing and analyzing every single day for 20 years, but this is also really helpful because it lets us all kind of hear that, the focus of where you are. So you could be a doctor who's done great work, but if you've done, 6 to 12 months of focused study, that's not really the same as 6 to 12 years
Sure.
of focused study in a specific area.
Yeah. I mean, it's in the same way that like an MD is not the same as a PhD in public health. Those, you can have skills that cross over.
But they're both called doctors.
They're both called doctors. They are not the same kind of doctor.
Right.
And it's not just the difference of one can prescribe medication and one cannot. It's an expertise that is different. And there is kind of even like a tension in this space of like MDs are still kind of treated as more experts, even in issues of public health. That's why you often see like positions of leadership in public health filled by people who have an MD and not a PhD or
But
a
they
DRPH.
could be cardiologist specialists.
They could be a cardiologist.
Okay.
Yeah.
Well, it's good to know.
Not the same
and honestly,
thing.
I have to bring you back because I think the conversation around medicine, I think we're probably going to dive into more later in the year. I mentioned not just to you, but also to a good friend of mine, Alicia Trice, who is a school psychologist, and she works with children with autism. She was on a couple weeks ago, and we're all eagerly awaiting, the good news, apparently. I think we heard it might be delayed, but in September, they've got the cure for autism. That's
The cause.
Oh, the cause.
The
I'm sorry.
cause.
The cause. But the cause would lead to the cure, right? Because once we know what
can
the
say?
cause
Yeah.
is, we would hope we'd be able
Sure.
to cure it. So
Yeah.
the cause of autism, I think they've been working on it since they came into office, which was about like 8 months ago, 7 months ago. And so I guess they've just been hard at work. And so we should in September find out what causes autism, which is, truly miraculous because autism's been around since the beginning of humankind.
Yeah.
And they've been working on it for 30, 40 years since we actually had a name for it. And when you talk about a 7-month turnaround, I think we're all eagerly awaiting that. So if possible, I'd love for you to come back and,
I'd love to.
once we find more about the cause, hopefully you'll have some information that could lead us to a cure. And maybe we can do that during our time on the
Yeah,
podcast.
I would also just love to know how you can do an experiment that fast, because as a scientist, I've never been able to do that.
Yeah, but I think that hopefully we'll hear all of it because, transparency is everything. And that is something that you've become known for, is your transparency. One of the things that I recall sort of, hearing about and talking about, and something I partook in also during the COVID timeframe was I opted to get the vaccine. That was my choice. And, it was my choice by exercising autonomy, but it was also through awareness of having a daughter who had gone and survived through stage 4 cancer. So I also was very aware of, your impact with other people. And I was thankful that she'd finished that process before COVID came around just the year before, because COVID could have taken her out, And so we chose to get the vaccine and document it. We shared that entire journey. If you head over to my Instagram, you can still see it saved in my highlight reel from, decision making all the way through. You did the same thing.
I did. Yeah.
Can you talk to us a little bit about transparency around COVID?
Yeah.
Do you feel like our administration has been transparent? Do you feel that, as the information was coming out, it was done with the intent to lead us, or that it was just we're sharing what we know when we got it?
Yeah.
Or is just science weird like that, where you don't always have the answers right away? Like, what was going on?
Yeah. So many questions to answer there.
Yeah.
And I'll start by saying that one of the things that I think I made a decision early on to not work with any pharmaceutical company during the pandemic.
And so that is something you were really passionate about. I've
consistently done that. I've kept that boundary for myself because I knew that it was an immediate accusation.
So you do not work for Big Pharma?
I have never.
And you don't get a check from them?
I have never.
Or anything like that?
Have never. I mean, as much as I, would have loved to have paid off my mortgage by now.
Paid off your mortgage? You could have paid off my mortgage. Okay, we could have paid off all the mortgages. Okay,
right.
Are you kidding me?
My mortgage is still very much intact. And so is my soul.
Yeah, right. I know, this is real. This is very real.
And that's not to say that working for pharmaceutical companies is bad. Mm-hmm. It's just not for me. And I also knew that as a messenger, as somebody who was communicating about the products that they are selling, I wanted to not have any conflict of interest.
And feel objective.
Mm-hmm. And so I never showed a preference for any of the products. I never showed a preference for any of the brands. And so I made it very clear, like, look, when I give you my anecdotes, they are specifically based on the data. So when those big reports would come out, those endpoints or the readouts from all these milestones in the clinical trials, they'd be like 90-page documents. I would read every single page.
But you knew how.
I knew how.
Yeah, which is part of school.
Yep.
So that's great.
Exactly.
Because I didn't want to do it.
Right.
So.
And then I would break it down in my stories and say, look, this is what they were looking for with this endpoint. This was the outcomes for this population. This was the efficacy. This was the safety profile. And I said, based on these data, based on what I have interpreted from these reports, the decision I was going to make, just like you, was to take the vaccine myself.
But you weren't telling anyone to, which I thought was really cool. You were like, this is what it says. Data's in the middle of the room.
Right.
Do with it what you will.
Yes.
Which I thought
I wanted
was really
folks
powerful.
to make informed choices for themselves. Like, yes, I was encouraging folks to do it because the data was so overwhelmingly clear that the benefits outweigh the risk. I also didn't lie to a single person and say that there weren't risks because there's risks in everything. There's risk in me sitting here right now.
There's risk in driving. There's risk in a car. There's risk in breathing.
Yes.
Like, absolutely.
Yes. Yep. I mean, I could choke on my coconut
water.
I
was just thinking that. You have a meal, it's like, and this could be it.
This could be it. Anything could be it. And so I absolutely, with full transparency, shared that there are risks because there are risks in everything. But when we look at the totality of evidence, the benefits far outweigh them. And that's why I made the decision for my very young children at the time to be vaccinated. And I documented it by the hour for 48 hours for each of us, how they felt, what they were feeling,
And you're all different bodies.
Totally different bodies, different ages.
Outcomes? Did you see that everyone had... I mean, is everyone still here?
Everyone's still here, thank God.
And now it's where we have some time behind. Have you noticed anything now that was different, or
nothing that would have been perceived as bad?
Okay.
In fact,
they're all okay right now.
They're all okay. They are all fully vaccinated with everything, not just COVID. They all tolerated the vaccines very well, my husband included, and my youngest, who was born in 2022, like mid-pandemic, has also been fully vaccinated and also reacted quite well too. I mean, I think that the delay that we had between babies 2 and 3 was in part because of COVID, and I got vaccinated pregnant too, and documented that. And I think that the time I got vaccinated pregnant, it made me really, really tired. And I had my husband, like, he took a picture of me like falling asleep on the couch, and I shared that photo. It was not a flattering picture at all. Yeah. But I shared it because I was like, it knocked me out. I was real tired, and I probably slept on this couch for about 4 hours because that's how lousy I felt.
Yeah.
So I wasn't trying to sugarcoat it at all. But like, on the issue of transparency and what the administrations are transparent, we're now on our third COVID administration, right?
And with different parties and different policies and perspectives and values and all of that. But, sort of the science of it's kind of remained the same, it seems.
It's interesting because you mentioned earlier, like, COVID is not behind us, and it's
No, it's
never
still
going
here.
to be.
Yeah.
It's unfortunately never going to be eradicated, and eradicated is a word we use where we can get it to no infections at all. And the reason
You
why
mean
it
like
can never
measles was kind
measles
of
was
close
eliminated,
to.
and the distinction there is that eliminated in the U.S. We're about to lose our elimination status.
I've heard. Do you think
which
we're
is-
going to?
I
or-
know we're going to.
Dang.
Yes,
That's
it's
rough.
imminent. It's really, really rough. The difference between elimination and eradication is eradication can happen for diseases that only affect humans. So we've only actually eradicated one disease in
Oh,
the history
wow.
of humanity, and
Which
that's
one?
smallpox.
Oh, wow.
Yeah, and that's because smallpox only affected humans. And when there are multiple reservoirs or host species, it makes it really difficult to eradicate. You've
Got
heard
it.
the stories of like rabbits and cats and dogs and deer all getting COVID. There's just too much variable. Like it's just too prolific.
So we can only really treat humans. We're not vaccinating every cow.
We're not going to vaccinate
vaccinating
every
rabbit.
animal
Right.
for COVID.
Right.
And so, but we could reduce transmission to elimination statuses where it's like the amount of transmission is at a low enough rate where it's not causing mass infections or outbreaks or epidemics rather. But COVID will be with us for the rest of our lives.
Like the flu.
Like the flu.
Got it.
Different from the flu, but like the flu in the sense that it will kind of persist and we will have to evolve with it as it evolves. And I don't know about the future of vaccines for COVID, but we will probably have to continue to be vaccinated against it as it continues to cause severe illness and death in some populations. Now,
this is actually something I think I want to dive into since
Yeah.
we're just going there, because you hinted at it, and I think that people, and I always, vaccines are a very sensitive topic for
Yeah.
some people, and I always want to honor that ultimately, as particularly moms, we just want to do what's best for our kids.
Totally.
We love our babies. We care about them. We want them to be safe. And we also are heightened about things that we may not know. And there's nothing like a good pregnancy hormone to have you being like, I just want to know, like, is there something I remember growing up where, the lead paint scare thing was a thing. This is, I'm dating myself, y'all, 80s baby, and people were like, oh my gosh, there were like videos of like, or commercials with like lawyers being like, your kid's eating paint chips and dying, off of the wall. So this isn't something we worry about anymore because we now have green paint that doesn't even emit a smell, we've evolved in our knowledge. I want to actually talk about vaccines. I have a new baby. I chose personally after, consulting with my pediatrician, after, looking at some of your content, and also after reading and learning and doing the research to get her vaccinated with a bonus vaccine of the measles vaccine early at the 6-month mark, which was the earliest she was permitted. It does not mean we will not be able to do 2 more, vaccinations, 1 at the year mark, and I think 1 at 3. Check with your pediatrician. This is not scientific advice, but people would say that was crazy.
Yeah.
People would say, what are you doing? Give her vitamin A or, give her, colloidal silver, there's all these things that are said to be solutions. And I kind of went with what has been scientifically proven to work. What are your thoughts on vaccines overall for our babies and our children? Is it something that, and why? Why is it something that I feel like we never asked about before? Why is this elevated to be an issue?
Well, yeah, so much to unpack there because I very much speak as a mom when I speak about vaccines
sure.
because why else would why wouldn't I, right? I'm not trying to be here and just be like, this doesn't affect me or the children who I would like run into oncoming traffic for. And as somebody who has also shared a lot about my postpartum anxiety and as somebody who is quite informed on things like that, I still spiraled on things that I knew objectively or based on data were low risk. But because you're seeing it in your child, you're like, but are they breathing?
That's
are they going to die?
Listen.
Because you have this baby.
It's
and
our hardwiring.
It's our hardwiring. It is biological. I mean, I remember I would put my finger under her nose, my firstborn. I mean, I've been doing this for almost 9 years and and you've been doing this for a lot longer for me than me. I just had so much anxiety. And so I share that with folks. And I also have a lot of empathy for the feeling of hesitation because hesitation is legitimate. And I think the spectrum of vaccine refusal is not just anti-vaccine.
So can we pause? I think that's huge.
Yeah.
I want people to hear that, is that sometimes when people are saying either, there's also an in between, not just vaccine refusal. There are people who want to delay.
Yes.
Or they want to change the time frame around the
Yes.
course,
Yes.
So, having vaccine awareness,
Yes.
and wanting to be informed and measured in your approach around anything parental related does not mean you are a bad mom or a bad person.
We all want the best for our children,
Right.
trying to make the best informed choice for the children that we have that are unique to each other and that we know the best. I fully can hold space for all of those things to be true. What is difficult is knowing that there are groups and individuals who are specifically preying on that type of mindset of I just want more information and manipulate information and then upsetting them to darker spaces of the internet where they're ending up either buying things that are just not evidence-based or even potentially harmful, and then keeping them from things that have been proven to be better.
Can you give us an example of something like that, just something really clear-cut that has been scientifically proven that actually occurred that was based off misinformation that caused harm? Because there's a lot of rumors and there's a lot of takes, and I just want to hear like a professional, grounded perspective.
Well, you mentioned one earlier. It's vitamin A. I mean, vitamin A can cause severe toxicity in children if not administered by a provider. And vitamin A is not a way to prevent measles. The only way to prevent measles infection is through the vaccine, through the measles, mumps, and rubella vaccine.
MMR.
Exactly. And so vitamin A can cause liver failure. It can cause very severe complications. In fact, it did actually cause harm in Texas in this most recent measles outbreak when people were told to take it prophylactically or preventatively, and it caused harm.
Now, who told them this? Was it their doctors? Like, where did you see the root of that?
If we're going to name names, there were people.
Well, I mean, it's just as long as it's the truth, because I don't want to get sued for defamation. So just so you know, I take that really seriously. If we are going to say it here, it's because it's true, it's provable, and we have data. I do not want to get, so.
Yeah. No, there were organizations like the Children's Health Defense, which was started by RFK Jr. He has since apparently not affiliated himself with them, but he started it, and they shared information about how vitamin A could be prevention. They also shared that measles infection could be cancer prevention, and said that it could be a good thing for your kids to get measles because it could provide protection against cancer later in life, which is neither of those things are true.
Are there any scientific studies?
Absolutely not. Absolutely not.
So I just want to ask maybe a very silly question, but I'm going to do my best because I think some people may be thinking this. I was told that measles is actually one of the deadliest things for children, if they were to get it, because there's actually no cure for measles. It's just you kind of have to let it run its course.
Therapeutic care. Measles is very dangerous for children, especially under the age of 5.
So how would we study cancer prevention if when you get measles, you might die?
So measles, the mortality rate for measles, depending on the population, is not as high as, say, other diseases. Sure. And so people will use that and say, oh, but not that many kids are dying, which is actually like a sentence that it boggles my mind. That we are okay with
too many.
One is too many.
If we have an answer, one is too many.
And we had 500 children every year dying of measles before we had the vaccine. The mortality rate after the vaccine dramatically declined because of the vaccine.
So it went down. It
went
did not
down.
go up. It did not stay the same.
No.
So it was 500, and we know that it was dramatically lower.
Yes.
Okay.
Yes.
Wow.
And the complications that can happen from measles are severe. It can cause blindness. It can cause deafness. It can cause encephalitis. It can even cause a very rare reaction. There's 2 kind of rare complications that can happen. One of them is that it can cause essentially immune amnesia, where it wipes out your immune system's remembering of other diseases, meaning you could become immunologically naive to things that you've been previously immunized against or have fought off with your own immune system.
Okay, so freeze. Normal people speak. So coming from a mama with a baby that fought cancer, one of the things that we always talked about was how chemo basically makes you so susceptible to everything.
Yes.
And it's like, it's not even the cancer that kills you. It's the whatever you get.
The pneumonia.
The pneumonia, the cough, the cold, whatever. So you're basically telling me that measles is the type of bug where it goes in and it can hijack your immune system so that you can't fight other bugs and you're walking around without protection.
It can.
So every day I'm fighting bugs and I don't even know it. So if you get a tiny sniffle or if you sneeze, but you make it, that could have been your body fighting off something big.
100%. Surviving measles was not a zero risk experience because it can cause complications later, including this immunological forgetfulness, and even another complication that can almost re-trigger the infection to cause a very severe form of encephalitis that can
cause swelling of the brain.
Yes, exactly.
Okay, got it.
Yes, and can cause permanent neurological problems.
So even if you made it, it might not look so high. And so using that as just sort of one example of, hearing things about vaccines and thinking, obviously, as a mama, this vaccine could be more harmful. It may not be accurately measured against the true harm of the actual disease. And that's the concern.
Yes. So and with all of the vaccines that you're given a document, a vaccine information statement, a VIS sheet that has all of that information in there.
So we can ask for that from our doctor?
It is legally required to be given to you with every vaccine. It's either physically handed to you prior to the vaccine, sometimes it's given after the vaccine, sometimes it's emailed to you, depending on what kind of document exchange system that you have at your pediatrician's office. Every vaccine, not just the one that...
Is it available online? Like
it
if
is.
a mom wanted
you
to
can
just
download
go
it
find
all.
that information?
Yes.
And who creates those documents? Because people will say, is that from Big Pharma? Is that from the government? Are they made by doctors? And is that information truthful?
That vaccine information statement is from the CDC.
Okay.
And it is available... there was a time when we were worried about our websites. It was taken down from the CDC website. I think it is now back on. We'll have to check on that. But it is available in other online spaces. I know I downloaded hard copies and digital copies just to have them on my own for all of the vaccines, just to make sure. There are groups like immunize.org that cataloged all of it too. But that is all in there. Risks, benefits.
By law.
By law.
Because if that information isn't provided, you're opening yourself up to major litigation in any case of vaccine injury.
Yes. And so this concept of even informed consent has become such a charged statement because it presumes that there isn't informed consent with the administering of vaccines. And I can't say this enough. Nobody is forced to vaccinate, right? Yes, there are requirements to enter certain spaces, whether it's school, whether it's
Why are those
jobs.
requirements there? I think that because some people would say, look, if I'm not forced, but there are systems that I pay for, right? Like my taxes pay for schools, my taxes pay for buses.
Yeah.
And, and I'm hearing that if I don't get these vaccinations, I don't get access to these things that I don't really have an option around paying for them. So, am I being forced? And also around informed consent, I'm not going to lie, I don't think I've ever read one of those charts before. Now, I have read synopsis. I've asked questions. I've looked at bullet points. I've had conversations with my doctors. I feel more than comfortable. But the fine print, and you're a communicator. This is part of what makes you such a gem in our world. And everyone, please follow this woman. Please follow her, because you're giving us the bite-sized real speak around the stuff we may not know. So are we actually being forced? Are we put into a bind? Or, because this brings us full circle back to public health.
Yeah.
Why is it that this is even required for school?
Yeah. I mean, we are compelling folks to do it because, again, it goes back to the social contract and the community aspect of public health. We are trying to reduce harm collectively. And we know that when there is a measles outbreak, and if you're around a bunch of people, if one person has measles and you're around 10 people who have not been vaccinated, 9 of those people will get measles.
Holy cow.
That's what we're talking about.
How do we know that?
We know this because of pre-vaccine data. And we know this because of populations that have low vaccination rates and how fast it spreads. There's a term in epidemiology called R0, which refers to the number of people one infected person can get sick. So COVID is like 1 to 2. Flu is about 1 to 2. Measles is 18.
Holy cow. So if someone with measles walks into a grocery store, someone else is walking out of there with measles.
If they're not vaccinated or if they're immunologically naive or somehow immunocompromised, yes. That's why you'll see these notifications
So basically babies
who cannot be vaccinated for measles until they're 12 months old, right? Unless they are in a high-risk area, then you can start like you did with your daughter, 6 months.
It's not complete protection.
It's not a complete protection, exactly. I mean, it's why you get notifications saying somebody at LAX who had measles was passing through Terminal A between the hours of 1 and 3 p.m.
Watch out for
next
symptoms.
next to the Sbarro, right?
Wow.
It's that because it can linger in the air for hours after an infected person passes through a space. You don't have to be in close proximity. You could be walking hours behind a person in a room who had active measles infection and still be at risk of infection.
So what you're explaining to me right now kind of calls in this phrase that I've heard recently that I just don't know much about. But I've heard that, there is a belief system around it. It's called germ theory.
Yeah.
Are germs a theory, or are they real, or are they not real? Or, because we all know, like, as moms will say, wash your hands, there are germs, but I can't see germs, but I do know I get sick. So can you explain to me a little bit more what germ theory is? Because I think that there is sort of a category of education that is coming from a space of maybe I understand germs or maybe I don't, because we're not all epidemiologists.
Yeah.
So can you just tell me a little bit more about that?
It's such an excellent question. And I really do think you bring home a very important point, because it seems like we're redebating something that has been settled science for a long time.
But I don't know if it is anymore.
Right.
So I'm kind of we all went through the pandemic. So we kind of got to see what it's like when a bug comes out, and then people spread around the bug, and then we change our behavior so the bug spreads less. Then we have a medicine, and now we can go back outside again because the bug's not here anymore. That's kind of like how I thought the order of events was. Like, we got to see the science by being part of the event, but our understanding and explanation has changed.
Totally.
So that's where I learned about germ theory for the first time. And are germs real? I mean, you have a whole job on
My
germs.
whole job is about germs. Infectious diseases are caused many times by germs. And this idea of germ theory is essentially explaining the fact that microbes are all around us, and some microbes can cause harm. Some can cause illness.
That's a word for germs.
Yep.
Okay, fancy word for germs.
Yep.
Microbes.
Some can cause harm, some can cause severe harm, some can cause death.
Okay.
But it's that pathogens, microbes that are all around us are the cause of illness in humans.
Is that always, or are there good microbes?
Absolutely. There's great microbes, but it's that some of them can be pathogenic, that can cause harm, cause illness. The inverse of that is something called terrain theory, where it excludes microbes as the origin of some of these diseases and says that it's really kind of the environmental things around us, which is unusual to me, because nobody is denying that environmental factors can also cause harm. Right. But to exclude microbes is wild.
So to make sure I understand the difference. So it's kind of like, I always like to give you can tell I was very good at analogies in the SATs, right? So you're telling me that germ theory is kind of like nature versus nurture, sort of. That concept. Like, was it the parenting style, or was the baby born like that?
Exactly.
So with germ theory, it's some people saying, look, the reason you're getting sick is because there are germs that float about, which is why we tell our kids, wash your hands, or don't lick that kid, or why I get a note, hey, someone in your class has whooping cough, and oh no, the whole class has whooping cough, or why all us mamas know about the back to school cold. We all know about that, right? The back to school cold, where the kids were fine at home, but now all of a sudden they've got colds, so that. But then the other side of it is none of that is real. That it isn't that there are germs floating around, that washing your hand is a silly thing, that kids can lick each other. It's totally fine. There's no need to even have chickenpox parties, because there is no chickenpox. Yeah. Instead, it's just that maybe the environment you're in has too much pollen, or that maybe you clean with too much bleach.
It's more sinister than that. It actually is quite racist, to be honest, too.
Walk me through, because people will say you bring race into everything. So I want to know the origin of terrain theory, which I've never heard of the term terrain theory. I've just heard of germ theory. So this gives me something else to look up. And for those of you who might have heard the word racist and felt a little ping to your belly, like, oh no, here is where we're going, I just ask that you kind of sit with us in this moment, because we're all learning something, and I am learning it too as a Black woman here on this couch. Well, I'm not the only brown woman here on this couch, but as a Black woman who could be very like, oh, racism, I don't know about this. Yeah. So I'm sitting in with you. So walk me through. How is this origin racist around terrain theory?
This idea of how you live and how you are being raised it's centers a elitism around things like food, nutrition, housing.
So it's racist and classist.
It's very racist
and elitist.
Classist.
So honestly, it shouldn't just be people of color that are upset about this. Honestly, if you're someone who grew up without a silver spoon in your mouth, if you're someone who may have had parents who needed welfare or support or help, if you're someone who grew up, with a little less than most, then theories like this are actually offensive to all of us.
Yes. I mean, this is a very like clear kind of intersection with the MAHA movement right now, where they're asking this question. A legitimate question is like, why is there so much chronic disease?
Yeah, that which we should all care about.
We should all care about,
yes.
and we do care about, and science and epidemiology has cared about for many, many years and has been working towards finding those answers. But they have concluded already that the only cause is terrain. It's, you know, the types of food that you're eating and the exposures of the things that you have in your diet and in your environment are exclusively causing it, right? Forgetting the fact that infectious diseases are a leading cause of chronic diseases, but also kind of asking legitimate questions and then finding causes that are not actually the root cause. And so they're saying things like, oh, it's because you're not eating organic.
But not the main cause.
Right.
Which is, I guess, where we kind of get into that weird bothy land where people are like, well, I'm not quite maha, but I'm a smidgen crunchy. You know, where it's like, no, like, so I'm African, right? Which means if my kids get sick, you better believe you're getting conventional medicine, but we're having tea, we're praying over you, and we're going to eat more vegetables. You're going to catch it all. Okay.
100%. Sort of I mean, as a fellow African, my mom will still get on me and she's like, did you put lemon in their soup?
That's right. And you know what I mean? Yeah. You're not having enough lemons. That's
exactly.
the answer. And which has got to be rough for you because you're like, the whole science says, let me just have my lemons. Mom, please let me just eat these lemons. So we get it, right? It's a little, I mean, I grew up with onions in my socks to draw out the disease through the soles of my feet. Okay. And I still do all of it. A little Vicks Vapor Rub for those of you who are of a Latin background, Vivaporup. Okay. It helps all of us, right? So knowing that it's a mixture of column A and column B doesn't exclude, though, the idea that a bug might have made you sick.
A bug might have made you sick. And also, there's a lot of shame-based
like
messaging
I wasn't dirty.
On the other side. Exactly.
Right.
So it evokes kind of this like classist and access and privilege sentiment behind who gets sick and who deserves to get sick. When really, like, being a human on this planet means that you will get sick.
It's the great equalizer.
It is a great equalizer.
And frankly, whenever I get sick and survive it, I throw a little party for my white blood cells. I'd be like, you better come on, immune system, okay? Not you out here doing what you do. Like, you're here for another day. Let's go. Like, you know, so, I mean, it's just like, I know that that's tough, but I think COVID was a great example of that. You know, these people who were quite wealthy were able to do things that some of us were not. They were having weddings. They were having parties. They were inviting people out. But guess what? People were still getting COVID.
Right.
Because.
Well, and this is interesting too, because that phrase, the great equalizer, does not apply to COVID.
Oh, tell me more about that.
Well, just think about the outcomes of COVID in certain populations. So the COVID tracking project, we had a separate dashboard to track race and ethnicity. And within a few weeks of mortality data coming out, it was abundantly clear that Black and brown people were dying at a rate that was almost 2 to 3 times greater than their white neighbors.
And was that because of terrain theory, or was that because of accessibility to hospitals, you know, information and awareness tools needing to work, you know, because
those are the social determinants of health, right?
And that would be public health.
There's zip codes where they are. I mean, a zip code is one of the
transportation.
Exactly. Zip code is one of the leading indicators of health outcomes that we have. Wow. Because it affects everything. It shows you your proximity to access, proximity to healthcare, proximity to transportation, the air quality that you live in, the food deserts that you might be living in. And the food deserts are I don't think people are talking enough about the fact that access to fresh produce and even just, you know, organic or better, which organic is not better.
Right.
Food, sometimes it's just not available.
If you don't have the fruit to begin with.
If you don't have it to begin with, you know, eating a frozen broccoli is not going to be like marginally poorer than a fresh cut broccoli that's $8 a head.
Absolutely. But it does also impact your life. You know, like I've got my daughter who, you know, grew up and she hadn't seen a fresh apple, like just in its purest form. She'd seen applesauce. She'd seen apple flavored fruit roll-ups. She'd had apple juice. So she was vaguely familiar with what an apple was, you know, but she told me that her first introduction to an apple was on a card, a picture, and she wasn't until she was about 11. I actually shared this with Dr. Jessica Nurek, who was here earlier talking about food deserts, you know, at length, because a lot of people didn't realize for her to get to a grocery store, it was 2 buses to carry home food for a family of 5, you know, and before I adopted her. And so, you know, now she is a veggie fiend, you know, but it was something that was not part of her life. She just didn't know. They didn't know what a tomato looked like, you know, but they knew pasta sauce, you know, and all those things are factors.
They are. And I think that if people want to understand like how we can all collectively be healthier, it's recognizing the fact that when we gentrify, when we create like pricing that is not equitable, and when we don't provide things like healthcare and SNAP benefits and all these things that are for the collective good, we will continue to have statistics that bring everybody's statistics down,
That's
right?
good.
You're looking at the United States as a whole and you're wondering why these numbers are like this. Well, we are all together in these stats.
Together, yeah.
And so,
and the greatest user of those benefits right now is actually the white American population here in America, which I think is sort of one of the things that's so frustrating to hear whenever race enters this conversation. Is there's a lot of assumptions that, you know, benefits are exclusive to people who are brown or people who are of an immigrant status or people who are undocumented or, you know, something of that sort. But, you know, we're kind of eliminating the fact that I think everyone knows someone who might have used SNAP, or someone you thought didn't, but was raised off of SNAP, you know, but ended up owning the car dealership in town. And it just goes to show the benefit of having that type of support towards upward mobility, you know? And so it's sad to hear that a lot of these cuts are happening because the effect isn't just on your livelihood and in your home, but on your health.
I mean, I think one of the biggest indicators that we'll see that this movement is not actually reducing chronic disease is coming for us. I think we will be seeing it in the data because of these types of cuts that are affecting people's access to healthcare and access to food. The outcomes are going to be speaking for themselves.
Well, I hope that we're able to avoid anything negative, you know, and that we come to love numbers as much as, you know, we do here on this couch, you know, but that also that we have access to that data, you know, because people like you know, are in the game collecting it and sharing it with us. And I appreciate that. And before I let you go, because we could go on all day, which is why I already said at the top. See how I did it, y'all? I had her commit to coming back, right? Before we even got into it. That's how you have to do it.
I'm
so,
committed.
you know, yes, you must come back. But I just want to know, just give us some working things to do, right? If you could give us one big ask, right? Just one thing that you know would help us sort of understand each other better, relate in this world better, keep ourselves safer, you know, whatever it looks like, what would that be?
I think in this digital age, social media will continue to be a primary news source for a lot of people. I mean, in some cases it is for me. I know I can get access to information about what's happening in the world faster on Instagram than I can going to a certain website.com, right? And I feel like because of that, my ask is that people stay sincere in their questions and curious in their asking of it, but to remove the sensationalism and to remove the antagonism. I think that there's a lot of repair work that needs to happen with the public and with public health. I can fully recognize that scientists and people in power don't say, I don't know, or I don't know yet, or oops, I may not have gotten that right. That's not easy language. As a mom, as somebody who practices repair in my household, I feel like I try to model that myself. And I think that my ask is that people kind of remember that there is a fallibility and a humanity behind public health. It is not intended to be coming across as a perfect solution with all the right answers. It's iterative. And sometimes we're working with as much information as the public has themselves. And I kind of ask for patience and a return back to civility when it comes to that type of discourse, especially online, because right now it's just a lot of screaming on the internet, myself included.
This is good. I mean, I think that a scientist asking for grace is like the least we can give you for keeping us all safe. So thank you so much for your work. I'm so grateful. I'm so appreciative of you being here. Again, we have to have you back because there's so much to come, and the bugs are everywhere. So there's always something good that we need to know. So yes, stay safe, and thank you for your time.
Thanks for having me. This was awesome.